if they need to come in. Yeah.
I did one of these on Instagram Live, and that one would not run on my computer. I had to hold my phone up the whole time. My arms started to get tired from holding my phone for an hour.
Yeah.
So that all these different platforms have different, nuances.
Yeah, the technology.
Yes. I'll broadcast if we are good to go.
Yes, we are.
Okay, we are live.
Okay. Thank you. Very good morning from New Delhi. On behalf of the Center for Environment, Climate Change and Sustainable Development at Impact and Policy Research Institute, New Delhi, I, Simi Mehta, extend my warm welcome to all of you. I take this opportunity to welcome our distinguished panel for today to discuss on one of the most pressing challenges which has been posed by the coronavirus pandemic, which is the waste management. Waste management is considered to be one of the most significant components of preventing the propagation of diseases and illnesses. However, an important question that comes up is, how does one ensure a scientific waste management of solid waste, sludges, biomedical waste, and hazardous waste during a time of lethal global viral illness? To avoid cross-contamination out of handling waste during the corona times, or I would like to put it as the corona waste, requires a meticulous mechanism in place to transit through the pandemic, and also to ensure that the degree of efficiency that has been achieved during these times are preserved and in fact enriched for the future. I also believe that it is important to document the impact of changes introduced by the municipal authorities and monitor the progress through periodic assessments. On this note, I am excited to introduce to you our esteemed panelists for the day. We are honored to have Dr. Keith Alverson as the chair for the session. Dr. Keith is a veteran environmentalist. He is the director of the International Environmental Technology Center at the United Nations Environment Program in Osaka, Japan. This center serves as a global center for excellence on environmentally sound technologies with a focus on waste management. Dr. Keith has also been the coordinator of the Freshwater, Land and Climate branch in Kenya, where he oversaw UNEP's global portfolio of projects in climate change, adaptation, and ecosystem-based mitigation, as well as terrestrial and freshwater ecosystem management. Dr. Alverson was also the head of UNESCO's Ocean Observations and Services at the Intergovernmental Oceanographic Commission and the director of the Global Ocean Observing System in France. Dr. Keith holds a degree in Mechanical and Aerospace Engineering from the Princeton University and a doctorate in Physical Oceanography from the Massachusetts Institute of Technology. He was a postdoctoral researcher at the University of Toronto, Canada. Dr. Alverson has a huge list of publications and has published in prestigious platforms like Nature, Science, Elsevier, and others, and has served on a number of several high-level international commissions and continues to do so. Sir, we are extremely privileged to have you amidst us this morning, and I'm confident that the audience would get to learn a lot from you. Thank you, sir.
Thank you very much, Simi.
Thank you, sir. We are also delighted to have with us Ms. Swati Singh Sambyal. She's a renowned researcher on waste management and has worked in India as well as across the global south on development issues concerning sustainable and affordable waste management. She has worked extensively in Tanzania, Ethiopia, and Namibia, and has enabled an implementation and process policy reforms and pushed for integrated waste management approach by adopting circular solutions. Ms. Swati is presently associated with the UN Habitat Regional Office for Asia and Pacific in New Delhi. She has worked with the Center for Science and Environment previously for over 9 years as the head of a program on municipal solid waste and has been a part of several national and international boards on solid waste management. Thank you so much, ma'am, for accepting our invitation and being with us this morning.
Thanks, Simi. My pleasure to be here. Thank you.
Welcome, ma'am. Our second panelist for the day is Professor Brajesh Kumar Dubey, Associate Professor, Integrated Waste Management and Sustainable Engineering at IIT, Indian Institute of Technology, Kharagpur, West Bengal. He holds a PhD in Environmental Engineering Sciences from the University of Florida. He was the recipient of the prestigious Endeavour Executive Fellowship from the Department of Education and Training, Government of Australia. Professor Dubey has been on the board of several national and international committees, including the UN Industrial Development Organization, UNIDO, Nigeria, American Society for Public Health, Washington, DC, World Bank, etc. He's an avid writer and has over 200 publications as journal articles, book chapters, project reports, magazine articles, etc. Professor Dubey's research areas include integrated waste management, environmental risk assessment, environmental engineering, and life cycle analysis and sustainable engineering. And he likes to call himself a garbologist. Thank you, sir, for being with us this morning. Before I invite Dr. Keith to make his opening remarks, I would like to make some housekeeping announcements for the audience. After the panelists have made their discussion, I would request all of you to, if you have any questions, to write your questions on the chat box, identify yourself and identify the panelist to whom the question is posed. So with this, I invite Dr. Keith Alverson to make his opening remarks. Over to you, sir.
Thank you so much, Simi, and welcome everybody who is online and interested in this problem and these challenges associated with waste management during the COVID-19 crisis. So I wonder who you are as audience. Presumably you are feeling a challenge. And I think that's one of the question is, whose challenge is this? At UNEP, we are a global organization and we've got some recommendations the same way World Health Organization and other UN agencies do related to COVID, related to waste management COVID, pitched mostly towards governments, national governments. But a lot of these challenges are not inherently national. You might individually be wondering what to do with your how to dispose your mask at the end of the day, for example. Or cities, municipalities are facing challenges associated with their standard solid waste management practices. How do they maintain services for people with the COVID crisis going on? How do they ensure social distancing of workers, for example? How do they protect the workers, both formal and informal, in the waste management business? There are also challenges being faced by institutions. You know, I'm sitting here in a building, which in my case is many, many stories high, and there's a waste management procedure and process in my building. Similarly, hospitals, individual hospitals or retirement facilities will have waste management procedures which will need to be maintained with some amendments to ensure safety and both of the workers, of the people in the institution, and of course more generally. So how do we adjust? How do we face those challenges at such a range, such a hierarchy of different scales? That's in itself one of the challenges, is we don't know who we should talk to, who we should engage, at what level of granularity to address this challenge. Another thing I want to say from the outset is, a lot of the times when we think about problems and solutions in the environment, we think almost by nature in a kind of a steady state way. There are so many tons of waste being generated per day, so we need to have a solution which can deal with this many tons of hazardous waste, this many tons of potentially infectious waste, and so forth. Unfortunately, with COVID, we do not have a steady state. We have an enormous growing challenge in many places, exponential growth in the presence of this disease, exponential growth in certain streams of waste. And we have uncertainty about the future. For example, in some countries or cities where there had been a great decline, there is now again, so taking the United States as an example, a lack of personal protective equipment, which is part of the waste challenge eventually, is now reappearing 4 months after it was supposedly solved. So my plea then is to think about all of these problems as we have to be, solutions must be adaptive because we're not in a steady state. Things are changing rapidly, and anything we see as a solution today or implement, we have to learn from it. We have to see how the impact of our measures, what sorts of impact we're having, and we have to adjust and in many, many ways, which we can't really predict well right now. One final thought before I turn over to the speakers is to think about multiple disasters. Okay, it's horrible enough thinking about COVID-19 and its waste management and the impacts of COVID-19. Here in Western Japan, where I live, we're currently facing enormous flooding challenges. We have more than 50 direct deaths from flooding, and there's a huge resistance among people to relocate to safe zones because they're concerned about COVID. And there's also a magnified challenge with flood-related waste and removing it because people are concerned that it might be contagious. So I think a lot of countries are now, because the COVID crisis is extending for quite a long time, are entering, say, either the cyclone season or the heavy rain season, or might have an earthquake, for example. And so it would behoove us to think about those other kind of shocks to the system that might impact anything we're talking about. And those can be quite large. So UNEP, it has some thinking. We're producing both some fact sheets and some reports on COVID waste management, looking very much at environmental impacts, thinking about human health and environmental health as sort of a combined problem that we can look at holistically. But many of our advice and our thinking is more oriented towards the national level. I think, I hope that in this short webinar, we'll have the opportunity to drill down at the municipal level and even at the personal level as well. So with that sort of general introduction as chair, I'm very happy now to turn over to the more substantive presentations. I think the first is from Swati Sambyal, who joins us from UN Habitat's office in India, I believe. So please go ahead, Ms. Sambyal.
Thanks, Keith. I'll just share my screen. Is this visible to all of you?
Yes, yes.
Great. Good. So I thought it's important to draw down what are the existing challenges that we are facing in India, and then I would be more interested in talking about the solutions, drawing down from a few cities in India that past few months have been looking out on, as in how cities in the country are combating on this complex issue of COVID-19 and waste. Now, broadly, if we look at where the waste is coming from, what are the sources? It probably is from containment zones or the red zones, the quarantine facilities, the COVID care centers, isolation homes, and quarantine homes, healthcare facilities, hospitals, and laboratories. So all these are the broader sources. And as Keith rightly mentioned, that we weren't adept in handling this kind of waste, since years, since decades. And accordingly, there have been a lot of adaptation in the guidelines that have come out recently. So CPCB very recently brought its third revision to the handling of COVID-19 waste guidelines, which was out on 10th June. And there have been constant updates and additions as compared to the old guideline, which came way back in March 2020. So of course, you all could refer to it. It's a document easily available online. But broadly, apart from the general categories of biomedical waste that have been listed, which is red, white, and blue, there has been a yellow category added, which would involve COVID waste being generated from households or quarantine centers, or for that matter, even facilities, hospital and healthcare facilities, which ideally needs to go for incineration. But here also lies a big question mark and the challenge. Now, broadly looking at where we are in terms of biomedical waste management in the country, there are over 200 common biomedical treatment facilities which are operational. About 23 are under construction. But what I really want to highlight, apart from the other figures that are there, is that, typically a government or a private hospital would produce about 500 grams of biomedical waste per bed. But now, during the COVID scenario, that number has highly gone up. It's somewhere between 2.5 to 4 kg, a drastic increase in, the biomedical waste that is coming out of hospitals. And the capacity of our treatment facilities are only limited. For instance, if you look at Delhi, as per the official data and figures from various sources, about 60 to 70% of the biomedical waste is being sent to biomedical treatment facilities. But there's a question mark to where else is it being taken? And this waste is not just from hospitals, but it also is from isolated homes or quarantined homes. So, which is a major concern. Coming straight to the challenges, of course, it's multifold. One is that we have dearth of workers and staff available for right collection and disposal. Many we know are already getting infected. For Delhi, I may say that about 40 to 45 sanitation workers presently have tested positive from the virus. About 15 have lost their lives. That is also happening because most of the times when you see these workers coming to your houses and collecting your waste, many of them are not even wearing their masks or gloves, or, the provision of these PPEs is not regular, it's not daily. So these workers are expected to either wear the same PPEs for about a week, or they're not given the daily supplies. Huge quantity of general waste is, getting mixed in COVID-19 waste. This is on record data, and I've been hearing it regularly from reporters and journalists and my data sources that households that have to quarantine aren't giving their COVID-19 waste in yellow bag. And even if they are giving, it is getting mixed with other waste, which is your general waste. Now imagine when this waste is going to a common biomedical incineration facility, and that facility is majorly equipped for treating of biomedical incinerable waste, but your general waste is also reaching there. So it may create a havoc also for the workers who are directly dealing with this waste, sorting masks and PPEs from your general waste. That's an issue.
Swati? Swati, can you hear us?
It looks like we lost her, or?
Yes, so perhaps her connectivity. Yes, so by the time, yes, ma'am, we lost you for a bit.
Okay,
okay. Yes.
Was I still on the challenges?
Yes, yes.
Okay, I'm so sorry. Yeah, so I think these are the challenges. Majorly, we're not segregating as a country. The segregation percentages are low. Our workers are, affected due to not using PPEs, or they're directly dealing with mixed waste and sorting it. We have a lot of lives lost, basically sanitation workers who are at the forefront of it. They're not getting PPEs daily. So broadly, these are the issues. But just a minute. Yeah. So as you can see, this is a picture where, hospital PPEs used by doctors are openly disposed. And we see this happening in probably a lot of cities across the country. I hope I'm audible, Simi.
Yes, you are, but we are unable to see your screen. So you need to share the screen again.
Okay, I'm so sorry for this technical glitch. I don't know why it's happening.
That's completely understandable.
Just a minute.
Yes, yes. Please.
Are you able to see it now?
Yes, yes.
Okay, let me quickly move to, yeah, so what I was sharing was that we're seeing a lot of instances where there is open disposal of PPEs and hospital waste. But then coming to, the challenges are huge, but coming to various interventions of cities, we're also seeing that there are cities that have taken effective measures against COVID and also managing waste. The first city that I would want to talk about is Panaji in Goa, and they have been so segregating since 2005. They've had an effective system of workers and volunteers and NGOs who have been constantly on the ground, educating people and managing the waste. And it's been one of the oldest cities that have been practicing decentralized waste management. And we see that during COVID, there has been a lot of awareness on how to handle the PPE waste, how to handle biomedical waste. And that's why probably due to even a surge of cases here, everything was handled well. And this city, we don't hear as one of the red cities where COVID is an issue, in spite of being a touristic city. Other city is from Maharashtra, which is Panchgani. And I often talk about this city because, again, it's a zero waste city. And a lot of efforts were taken by the mayor here in ensuring not only source segregation happens, but it happens into PPEs and domestic hazardous waste as well. There is a modality wherein every week or every 14 days, such waste is collected from households, which is your PPEs, your masks, and other, potentially infected waste, even from an asymptomatic patient, and it goes to the nearest incineration facility. So again, robust waste management and awareness is coming out to be a game changer in city. Another city that has really done well in these tough times is Ambikapur in Chhattisgarh. What's amazing is that the model is managed by 447 women workers, which are a part of a self-help group that manage waste, that manage collection of waste, and they've not been able to ensure enough awareness amongst cities, among the residents of the city, but they have also utilized the SHG to prepare sanitizers and masks as per WHO standards and distribute it amongst residents, and there is a penalty in both Panchgani as well as Ambikapur if you don't wear a cloth mask and if you just step out without wearing it. So again, effective awareness and effective waste management. Kerala, we've known, has been on the forefront of waste management past many, many years now. And major cities here have been very effective in handling of not only the waste, but also in ensuring that residents treat their waste at source. Thiruvananthapuram is one such city where households are not only segregating, but they're also composting or using biogas technologies to manage waste at source. They're also stocking up dry waste, divided into multiple fractions at household level, and then it's collected, including PPEs within the city. And this city was known to have a, very successful containment plan, because initially we saw maximum cases coming from Kerala. And, I think its plan is well acknowledged nationally as well as internationally. So just sharing a few slides. Vijayawada in Andhra Pradesh is another city which was able to take effective measures to not only manage waste, but also, handle an effective COVID-19 response by educating the workers, by doing, various mock drills for them, by ensuring that the city had an effective containment strategy for various levels of cases that would come out, right from high risk to low risk to asymptomatic patients. So I feel that educating and spreading awareness and creating effective containment strategies with focus on waste management and disposal is the need of the hour. And I feel not just these cities, but many other cities, I would say Mysuru is one and Bangalore has one, which have really, been a game changer in terms of what they've done with COVID-19 and their responses. The lessons that I personally as a researcher feel that we need to pick from all these interventions. Of course, the slides will be shared, so you could go through all the details, but I would want to highlight on what we have learned. One is that segregate, segregate, segregate. That's the need of the hour, that should happen at any cost at source. And what's important is the social engineering aspect, which is how do we change behavior also in these tough and challenging times? Because at the ground, when you would really dissect the issues, the number one issue that would come is that households are not segregating their waste. The collectors are taking mixed waste. They are then sorting it further, which makes them more prone to, getting infected. So it all has to start from you and me, which means we have to segregate at source, which means the decentralization component, here it comes for the fact that we have clearly seen that cities that had a very active citizen engagement via NGOs, via volunteer groups, via self-help groups, they were more effective in their COVID-19 responses because they had this community behavior and community social engineering aspect already addressed by involving all these groups. So when the time came to spread awareness around COVID, it was much easier for such cities as compared to cities, for instance, even like Delhi, which has a very centralized waste management system. But I feel that doesn't mean that any big city should have a big jolt right now. What they should be doing is at institutional level or at residential level, at community level, spread awareness and use the active resource of various groups. That's the need of the hour. And localized action has really been a game changer for COVID-19 response in India. Just to, kind of draw inference to what I'm saying, every month I kind of am mapping cities that are practicing centralized waste management and what are the number of cases, and cities that have majorly a decentralized waste management scenario and what is the case. And if you clearly see, it has a direct correlation even with waste management, because all your green cities are cities that are practicing decentralized waste management. All your red cities are cities that are centralized. And you can clearly see that cities that have a more localized action have also had less cases when it comes to cities with centralized interventions on waste management, which means it's only the private party and the municipality. So clearly, what I'm signaling towards at the end of this, presentation is that we need more localized action, we need more sensitization, and segregation. High time has to be, it's the need of the hour for effective COVID-19 response. So thank you. I'm sorry for the glitch. Yeah.
Yes. Thank you.
Thank you.
Swati. Yes, sir. Yes, sir. Over to you.
Thank you very much, Swati. That was an excellent presentation with some very thought-provoking results, especially I think the last slide. I mean, this concept that decentralization will lead to some resilience to COVID. And I think maybe when we get to the questions, we can try to unpack that a bit more, because it's probably different in different places. And the level of decentralization is going to be a question. So I'm really interested to discuss that further. But I don't think we're going to stop for discussion and questions now. My understanding is we will first take our second presentation and then open it up. So let me call then on Professor Brajesh Dubey from the India Institute of Technology to give us our second presentation. Thank you.
Thank you, Keith. Wonderful presentation, Swati. So I'll kind of build on where you left. And let me share my slide. Okay, so can you see it? Can you see the slide okay? Okay.
Yes, sir. Yes.
Okay, so the topic we all know, we are talking about the challenges on waste from COVID. And And also we'll talk about slightly what's the way forward. So I thought since I've seen that many times during these type of webinars, we have many students and other people on audience who doesn't have a much understanding of what is waste, how it is managed, what is in there. So I just have, and being a professor of this topic, I try to give a little bit of background. So this, what you're looking at on the slide right now, it's a report which came out by World Bank in 2018. I think it came in around October or November of 2018. And it kind of gives us a snapshot of where the waste management, solid waste management will be in 2050. Swati focused on biomedical and other stuff. My talk will focus more on municipal solid waste and its impact on like COVID impact on municipal solid waste management. So I'm talking about municipal solid waste right now, which you and I produce on a day-to-day basis. So presently we produce around 2 billion tons annually, and that is expected to go up to around 3.4 billion tons by 2050. So there's a huge amount of waste that needs to be managed. Now with this new normal of this COVID, so there is, of course, there will be an impact. So as Swati mentioned, that segregation. In one of our slides, you may have seen that segregation. So as you can see, there are the different components. We have metals, we have glass, we have plastics, we have papers, and then we have this food and green waste. For our audience in India, we know that Solid Waste Management Rules 2016, it requires us to do wet and dry separation. So your dry part is your metal, glass, plastic, and paper, and your wet part is the food waste. So if we keep this separate, there is, of course, we can manage it properly in regular times, as well as during this COVID times, which I will come in a minute. But if we mix it together, that creates a lot of problem, because mixed waste is actually, you cannot really do much with the mixed waste other than putting it in a sanitary landfill, because even waste to energy plants doesn't work well with the mixed waste, as we know. And if you look at the waste generation, this part of the world, South Asia or East Asia, the Pacific, and Central Asia. So Asia is kind of the highest. If you look at the total waste, if you look at per capita, still North America will probably lead, and North America and Europe. But since the population is higher on this side, so for those people in the audience who are interested in being an entrepreneur, try to have a business, garbage waste management, there's a lot of industry needs to be set up in India with proper technology, and other countries as well. I emphasize on proper technology. All technologies are good, but you have to make the conditions for it suitable. It's not that many technology which is working anywhere in the world is working there because the homework has been done properly. In Indian context, many times we don't do the homework properly. And that's the reason why the technologies fail. And unfortunately, the technology gets a bad name. It's not the technology is not the problem. One of the major problem, which I wrote a piece in Economic Times almost more than 2.5 years ago now, that for effective disposal, segregation is the key, which you heard from Swati as well. Segregation. Without segregation, you cannot really do much on waste management. Now, coming to this COVID or coronavirus case, we are seeing a huge increase in plastic, especially a lot of packaging material with the online shopping, people going for panic buying, PPEs, stockpiling. So there is an enormous increase of plastic waste and other packaging waste coming into the waste stream. And I'm talking about municipal solid waste. Of course, one thing which has happened, like because of home quarantine and those asymptomatic case, like where you don't have the symptoms yet, but you are still carrying the virus and you're using all those masks and other things. So even waste coming from individual houses, there is a risk associated with that. So we have to, as Swati mentioned, that we lost 40 sanitation workers in Delhi itself. For other cities, we don't have that much data out there yet, probably will know in future. So that's a concern, because people are getting exposed to it. Our sanitation workers are getting exposed to it. Another bigger concern is that during this lockdown period, if you remember, the waste collection is an essential service, but waste recycling is not. So the recycling pileup was there, and informal recyclers, we know how most of them work in developing countries. They are at a greater risk in terms of managing all these waste which is coming out. So, and we saw this plastic showing up, in fact, in the beaches. You may see on the right-hand side, you are seeing a picture of a gentleman holding all those masks and other stuff. This kind of pictures is very common now. You can find it from different places in the world. This is from Hong Kong. and you'll find in Europe. We saw some in even people have found in France beaches. And so you will see pretty much everywhere in the world, we are seeing these PPEs and other things showing up. And that reason is the improper waste management. And the plastic, which was kind of getting a little bit of beating in terms of because of the plastic waste. Again, if you look at plastic as a material is not that bad. The problem is the plastic waste. If we are not managing the plastic waste properly, that was the problem. Plastic as a material, actually, if you look at even to the hospitals today with all our friends and whoever are there in the hospital, most of those life-saving equipments which is out there is majority of plastic. That single-use plastic actually becomes an issue. And that single-use plastic is increasing during this Corona crisis. So that's, recently we did a webinar, also some media launch. Some of you may have seen that on, which was done as a blue paper for World Resource Institute, where we looked at plastic in ocean and all that. That document is available on the web. If you are interested, we can share that with you later on as well. There also we talk about plastic and other pollution going into the ocean. On the left, you can see here that in the PPE, the full face shield, the face mask, the gloves, single use, long sleeve fluid repellent gone, or surgical mask, disposable apron, they have different types of plastics which is there and which is creating problem in terms of its disposal. Factors which is in the recycling center, this plastic recycling, as we know, whenever there is a slump in oil prices, plastic recycling business suffers. And with the transport restrictions during this lockdown, the recycling industry also suffered during that point as well. We had shortage of staff because of the lockdown, people not coming for jobs, and they were not advised to come. So there was an impact there as well. So the recycling industry did get impacted due to the this Corona crisis, even continues to get impacted as well. Hygiene concern is there in terms of consumer preference, where we are going back to the single use rather than going for reusable. There is a false sense of security that using this single use plastic bag, or even I call it a false sense of security when we compare with the other packaging material. For example, if you compare paper versus plastic, paper, what has been reported so far, this virus is kind of alive and kicking on paper for almost 24 hours. And for plastic, it stays for 3 to 4 days. So actually plastic is, we should use more paper rather than plastic if you go by that. But plastic is convenient. It's a convenience, moisture proof. So that's what makes plastic usage actually much higher in terms of packaging material. And then we have the metals and other things. So there are different surfaces on which this virus can be active on for a certain number of days. So that has an impact on recycling industry as well. So if you look at the recycling industry, they should now, if you bring recyclables to any recycling place, you should keep it for 3-4 days to let this virus being inactivated. Now this 3-4 days means you need more storage space. Do we have that infrastructure? How to do that? So those things comes in picture. Should we store the waste for 3-4 days in our house rather than sending it? Because that will also reduce the risk to those sanitation workers who are collecting this waste. Plastic, there was a ban is being rolled back. Coronavirus fears has reversed hard-fought ban on single-use plastic. And so there will be an increase in plastic usage, which is going to happen. So we need to learn better manage the plastic waste in this post-corona world, which hopefully will come in a few months from now. I hope that it comes very soon. So there will be, of course, aggressive plastic industry. We have to have behavioral change, the economic concerns, because of, as I mentioned, because of low oil prices, many times this plastic is essentially oil. It's coming from the crude. So, but it also has a lot of pigments and a lot of binders and other things which has negative human impact. Plastics, as I said, are helping us, but are we responsible users? So this slide actually comes from Dr. Vijay Habbu. He has recently shared a presentation with me. So it is his slide. So where you can see these pictures where in the middle, you see that in Hindi, where basically 2 dogs trying to fight on that mask. And then on the right-hand side, you see the mask being just littered all around the place. So it says the biggest virus on earth is still the human behavior, which is, and that's kind of holds true. Because from the houses, even the people who are on home quarantine, we are seeing the mixing of the PPE waste with the regular solid waste. so regular municipal solid waste. Proposed practices to fight, we have to move, trying to go from manual to automated systems, where try to get less manual labor, try to have more automated system. That also has another ramification, like in country like India, where we have to produce job, where there are a huge a good amount of population, which makes it living out of garbage. So how we do that? So though, of course, the transition will be there in terms of having a better PPEs for them, and coming up with so that they are less exposed, so that we don't get negative impact on them. Landfilling is still in many parts of the world, including in India. Landfill, sometimes it's considered a very bad word, but some sanitary landfill, as a solid waste engineer, I feel like that there is still a place for sanitary landfill in any integrated waste management system, because there will always be some waste which you cannot recycle, you cannot incinerate, and they have to find a resting place. Otherwise, they will keep on littered around and will end up in our ocean or sea and or in other places. So transition could be incineration, chemical recycling for automated systems, or we go for this bioplastic. Bioplastic, whatever is out there right now, they claim to be 100% biodegradable, but many of them are actually not, because they need very sophisticated industrial grade composter to work. We have seen it in our studies. In fact, when I was teaching in Toronto area, in Guelph, city of Guelph, we had this compost plant where this biodegradable plastic, even after 2-3 cycles of compost, it was there. So it was not really degrading very well. And of course, we need to kind of go towards a bigger concept of that circular economy. So this is my summary slide, and then I think I will end. So it's in terms of the solid waste management trends during COVID and after that, if you look at from the very beginning to the very end, so we have this waste generation from household, quarantine homes, temporary medical facilities, healthcare facilities. Temporary medical and healthcare, as Swati mentioned, it is essentially going to biomedical waste. Quarantine homes, if it's a dedicated quarantine home, it should also go to biomedical waste. But in many developing countries, including in India, we do see biomedical waste mixing with regular municipal solid waste and ending up in our dump sites. Household, it's mixed garbage, and source segregation is still very low, other than some of the case study you heard from Swati, and some other places also they do it. But other than that, it's again a mixed garbage, and and this PPEs and from people like you and me who may not have any symptoms, but still we are carrying virus, those things also can come into this mixed garbage. So there is a concern over there. Sorting is storage. It has to go to more, at least have a more storage. Let the virus be deactivated over a period of 3-4 days. And then you handle that either at your home level or at a collection center, or go for more mechanized system. And this biomedical should be treated in biomedical designated facilities. Then collection system may require more number of trucks, increased frequency, because the waste generation is also going up. Frequency of collection, we may not collect all these recyclables after maybe 3-4 days. So that's how the virus will get deactivated. And then may require more number of trucks, increased frequency from healthcare, temporary medical facilities, and all that. And then for the treatment system, we have to go for more automated facilities to encourage prevent infection. So, and our composting, anaerobic digestion, all those things are there, incineration, deep burial for other type of waste as well. So this is kind of in detail. And those who are a student in the audience, those of you who are interested, I do teach a MOOC course, online course on integrated waste management for a smart city. There is a terminology, smart city, just to catch the eyeball. We are talking about basics of integrated waste management for any city or town. It's focused on developing countries. And this course has been offered already 3 times. So this will be the 4th offering. And we have more than 25,000 students already have taken this course in the last 3 offering. And this is MHRD, Ministry of Human Resources Development, Government of India funded course. So it's a free for any enrollment. For the certificate, you need to pay a fee. So if you're interested, you can always go and search for it. You'll find it. If you don't find it, send me an email. And so that's pretty much where I would like to end my presentation. Thank you.
Thank you very much, Professor Dubey. A very enlightening talk on some of the challenges of waste management and how they've been impacted both directly, with increased amounts of plastic waste, but also some of the indirect impacts, which maybe we can touch on in the discussion, because many times things like frequency of or location of waste, or there might be guidance to stop, as you were saying, reduce the rate of collection of recycling and so forth. Some of those things, which are not directly related to COVID waste, but are impacted somehow indirectly. So it's quite interesting. Before I turn it over to general questions, I see we've just been joined by Sameer Unhale from the Angar, Mumbai metropolitan region. And I believe you might have some comments that you're able to make based on your municipality's impacts and solutions. So please, Mr. Unhale, can you give us a brief intervention?
Yes, thank you, Keith. I think I'm audible. Am I audible here?
Yes.
So first of all, I must congratulate IMPRI for focusing on waste management. Normally, it does happen that the much more glitzier and much more important part of urban infrastructure gets highlighted, and solid waste management, which is it's one of the most basic and fundamental functions, doesn't get that kind of focus. So thank you for that. India's urban ecosystem, if you consider the last census figures of 2011, we are the Indian cities are almost the third world largest country. What I mean to say is that if you add up all the population of cities in India, it will be more than what the United States of America's population is, and that in that sense, Indian cities are the third world largest country, and that is the impact that Indian cities are going to have on the entire global discourse and narrative on any issues of urban affairs, including the solid waste management. I have been working with most of the municipal governments priorly. Sometimes I have worked at the provincial level, and the ground realities of functioning, I think we will have to admire and appreciate the efforts that are put in by the solid waste management laborers of the various municipalities, as well as the contractual work now that's going on. It has always been, I always, it is something like, the sanitation slavery that, our people had to work on. It is not a work which everyone likes. Very honestly, people have been working on for generations together. Sometimes the people who work with solid waste management are coming up from a particular socio-economic group. And in that sense, the professionalization of solid waste management, and if one may add the commercialization of solid waste management, in a way should have uplifted the traditional people who are working with the solid waste management. And I hope that the stigma that goes with this work is removed. It is seen as important and as equally significant work, like a medical professional service. It should also be that social recognition needs also to be given to the entire sector of solid waste management. I might be just sharing some of my examples, as to how when the COVID started, in around March in India, it started around 15th March. Various Indian cities started getting examples and the cases of COVID, and then the geometric progression really hit us then. So during the initial phases, there was a lot of confusion in the mind of the solid waste management workers. I'm talking of the municipal staff actually. When there was a lot of element of fear, there was an element of the spectrum was so wide. Some of them were extremely scared. Some of them were absolutely careless. They just didn't bother what exactly this was, and that's why we did suggested that some online or some local language training needs to be given to the municipal employees, to what exactly the this COVID is and what precautions that need to be taken. So in fact, I do feel that municipal staff, solid waste management workers from municipalities, as well as the people who are contracting or working through contracts on solid waste management, need to be taken up into the formal system A, and more efforts need to be done for training them. Some training modules should come up in local languages on telling them what exactly needs to be done, number one. Number two, from municipal staff, we shift to the individual homes. Solid waste management is a sector, in which individual behavior of all the citizens matter a lot. Unless you find that the each and every home of the city takes upon some responsibility upon to themselves, it's only then you could see some credible changes in the way solid waste management of that city would improve. I mean, the municipal staff and contractor staff all put together are not even 0.2 or 0.1% of the population of the city. That is so you could really can't expect maybe 10 people taking care of maybe 1000 the garbage generated by 1000 people. So reaching to each and individual home and sensitizing them about the responsibility that they have apart from paying taxes and making complaints. The citizens ought to be appropriately sensitized on the things that they should be doing at their level. Of course, the sanitation, the entire Swachh Bharat Abhiyan, the Clean India mission that was implemented in India from 2014 onwards, did make an impact, did make this issue of solid waste management an important part of the entire urban narrative of India. Yet the people's contribution, people's sensitization, and in a way responsibility for being I will use the word reasonable citizen. Forget responsible. Being a reasonable citizen of a city, they require much more efforts to be put in, and that effort, that's community engagement, needs to be increased a lot. We ought to take help of all our housing societies. Is a very important movement in India. We have lots of housing societies, cooperative societies coming up. We could be engaging their managing committees to tell what needs to be done, because unless all the houses of the city contribute significantly, this issue would always be there. Shifting from that and discussing more on the COVID issue, the testing of municipal laborers and also the rack pickers for COVID, I think has to be specifically focused and targeted. Because in fact, it was a very nice presentation by Brajesh Kumarji. I saw his slides. It really tell the in a very small expanse. It really told most of the issues. And if the waste is mixed up with the usual municipal solid waste, I think that is going to be very disastrous, because the house to house collection we have been starting. Maybe someone from the housing society comes up here. If you talk of the Jhuggi Jhoppadis and the informal settlements or slums, normally it's just strewn around. And if as it was pointed out, if the COVID waste, or shall we say the waste that comes out of COVID patients' houses also, and maybe the plastic which was mentioned, the mask, it could really be very dangerous. And in a way, that needs to be targeted. That needs to be targeted. So again, community sensitization. What is segregation? Segregation, maybe wet waste and dry waste, we are aware of that, but biomedical waste or the hazardous waste, so to say, that has to be put on more strongly to all the citizens. Urban poverty is a important element of not only urban ecosystem of India, but I think the entire global south. If you consider right from Chile to Philippines, the entire global south and the urbanization that you are seeing there is urban poverty is a very important element, and how COVID would be affecting them in the livelihoods, and more importantly, the impact of the proper or improper solid waste management behavior that comes up from the informal settlements and houses would also create a major concern for how we are going to contain this epidemic. Right now, so that needs to be what I personally feel is that engaging with the community and making each and every house and home and a mother or maybe a son and daughter aware as to the importance of their role and their contribution into containing this epidemic, I think is very important. And that aspect needs to be coming up to the community more prominently. Maybe we can think of collaboration of international agencies like maybe UNEP and maybe various other philanthropies, various international development agencies coming together, creating a proper content A, and B, making localizing it by local language, and the appropriate symbolism that exists will be an important part as far as solid waste management and COVID is concerned at the city level. I'm sure there has to be a greater interaction between city administrators. Maybe when maybe we're working probably in India, we ought to know what's happening. Maybe in South Brazil is probably facing similar situations like us. So this interaction at intellectual level, at academic level, at maybe your uh, uh, these interactions have to go down to the actual people who are the practicing municipal governance and administration. I think that is a gap which I am saying. I think if that also that needs to be bridged, more experience sharing is to be there, more best practices ought to be identified, they ought to be circulated. But I think that we could work on that. And more importantly, if you want to engage with COVID, the essence is the speed. The speed, it sometimes it hits like a tsunami. The geometric progression is something which we have never really comprehended. We work on the linear level, and when the numbers start increasing, there's a lot of panic. And last point I really wanted to share is that I feel that media has been absolutely irresponsible in their reporting on COVID. I really don't know how to put it, but I think media has been absolutely irresponsible the way they are reporting on COVID. Lots of confusion, lots of problems. No one knows. There's so much of fear and panic. You might be realizing that if one patient comes positive somewhere, the entire neighborhood goes into panic and frenzy, and that is absolutely, if I may use the word, stupidity. Actually, I mean, yes, it is a dangerous epidemic. We have to take care of that, but the fear and panic which has been spread by media has been absolutely irresponsible. And all the real facts ought to come to the people there. Yes, some segment of media are being very good. They are telling what is to be done, but it is a containing COVID, and this element of solid waste management is not going to happen only by the municipal or the state agencies. The entire city, all the citizens will have to be a very important participant in this exercise of containing the epidemic. So those are the few thoughts I would share. I had to share on that. Thank you.
Thank you very much. So that was a third presentation from the point of view of an active municipal administration. So we've had quite a range of different types of presentations. I've seen a whole lot of questions coming down on the chat screen. I'm not sure exactly how we want to handle those, Simi. But maybe I could turn to Simi for a little guidance now on whether you want to select some questions. Maybe we can take a few and then turn it over to the panelists. But Simi, maybe you can give us some guidance now.
Yes. Thank you, sir. Thank you, all the panelists. And thank you, Sameer, sir, especially for joining us a little late, but on time. Thank you very much. So, Dr. Keith, we'd like to club a set of questions for the panelists. Some of them have identified which panelist they want the answer from, but they are mostly general. And for those, I would identify the panelist name and then the question so that they can respond accordingly. So I would club a few questions together so that they can the panelists have some time to go through. So the first question is to Professor Dubey. How would COVID-19 impact in healthcare waste management, and how can we minimize the impact of human health, as we know that the coronavirus pandemic is contagious and human to human transmission? So this is one question to you, sir. And another question is some more details on the possible entrepreneurship opportunities which this pandemic can create for the youngsters, and that can make it a little fun for the citizens to get involved in proper segregation and appropriate disposal of wastes. The next set of question is for Swati. What are your recommendations for recycling the industry? What are your recommendations for recycling industries? Any suggestions for modifications in the CPCB and other guidelines for COVID waste management in household and institutional waste? And one question for Mr. Unhale is, what kind of contingency plan can be developed by the local bodies that ensure uninterrupted essential waste services while ensuring complete safety of the personnel? At your level, what has been done? So if you could answer these three set of questions, and then we'll go on to the next. Yes, sir. Professor Dubey, over to you.
Okay, thanks, Simi. So I have to remember, since you asked so many, there were so many questions, and I tried to note it down. So, okay, so in terms of the first one, in human health impact from COVID waste, I'm a garbologist, as you introduced me in the beginning. I'm not a health expert. So I want to make it very clear. So I will talk from a waste management point of view, so what we can do. But in terms of medical issues, of course, that's not my domain. So as I mentioned during my talk, as well as Swati mentioned during her talk as well, that we are seeing impact on the sanitation workers from this like improper, I would call it a improper management of PPE or COVID-related waste coming from different, either from quarantine homes or from hospitals and other places. Because they're not being, as per the protocol, they should be put in a bag, and then actually they're asking to put in 2 bags. So 1 bag, and then you put it in another bag from our house, and that should be that's how it should be taken from collected. But unfortunately, we mix it with our regular municipal solid waste from a house perspective I'm talking about, and then that creates that creates an exposure scenario. And if it's exposed, I know only what is reported in news articles and media. So it's based on the virus does have a certain life on certain types of surfaces, and most of the advisory also keeps on changing. Just a couple of days ago, we hear that now it's a airborne, so it's kind of any other virus. So we don't really, I think even at this particular time, we don't really know about this virus very well. It's all based on what is the research is being done. So it will take some time. But as of today, of course, in terms of taking proper precaution from waste management point of view, is to keep all your mask and other PPE stuff that we are using as a non-symptom patient, as asymptomatic patient. It's very difficult to pronounce that word sometimes. So it's better to keep that waste segregated from our other waste that we produce in houses. The other regular waste can actually go as it has been managed, hopefully in a source segregation manner, but many places it is not. But this PPE waste should be separate and should be, ideally it should become part of the biomedical waste. So it should go to a biomedical waste system. So that's what it should be. That will help in terms of keeping.
If I could just interrupt very briefly, I mean, that sounds very important and great, but just thinking about myself, I use a mask. I'm sitting here, well, I'm not in India, but in Osaka. Even if I collect all my PPE, put it in 2 separate bags, I then don't have an ability to dispose of it as a biomedical waste. I only have my recycling streams and my household waste. So although I agree that it's a good practice to separate as biomedical waste, I think the reality in many, many cities is that double bagging is something you can do, you can ensure, but separating as biomedical is often difficult. That's not true in hospitals, of course, but as a guidance to people, it's a little difficult. Yeah.
So in that case, if your International Solid Waste Association issues guideline, if you look at, or some other guidelines, the recommendation is you put it in a sanitary landfill. So you put it in a sanitary landfill, which again, in a country like India, we don't have that many sanitary landfills, so that becomes a problem. So ideally, yes, biomedical waste, if possible. If not, then you put it in sanitary landfill. Of course, do the bagging. Of course, you do the bagging so that its exposure will be less, and keep it away from the other household waste. So that will help. Otherwise, the regular household waste is also contaminated now. So then we cannot recycle those. We cannot do any resource recovery from that waste stream. So that was on first part. And then entrepreneurships, waste, actually, there is a lot of money that can be made from the waste management if it is done properly. The problem is, and without source segregation, no technology really works. We do get some technology suppliers coming from different places in the world trying to sell technology in India, saying that this will work or that will work, but we have to do source segregation. So those, the people who have raised this question in terms of entrepreneurship, number one will be to try to have so again, source segregation, waste management is one area where we have municipalities and the city government has to get involved. One aspect which I see, especially in the Indian context, I had a chance to work in US, Canada, and a little bit in New Zealand. Government is involved there. Government, it's not that left to the private sector. That whole concept of private sector will come and solve our problem. That is not going to do, because waste management is one area where it requires like a long-term planning. Private sectors, they want short-term gain because that's how the business works. So of course, the private sector will work as long as the support is there from the government. The government has to do the hand-holding. One example that I would like to give is in terms of that EPR concept, that extended producer responsibility. Now, if we ask individual companies to set up their own plastic recycling stuff, it's a problem. But if there is a fund where this plastic recyclers comes on board, they get support from the government, from the revenue generated from these plastic plastic manufacturers or sellers. That kind of makes more sense to me and that's how I saw in Ontario Stewardship Program as well when they were working over there. So in terms of entrepreneurship, again, resource recovery from waste, we need to have a lot of secondary resource in this country. It will require a big investment. Maybe Swati can add to it. She is working a lot in the field, and Keith can add to that as well. But it requires substantial investment, and where you need to work with the government agencies to come up. You can set up some compost plant. You can set up some anaerobic digestion, which in few crores, but that again is decentralized. But again, that requires help from the government because the waste is owned by the municipality. So it's the municipality usual, and that's how and municipality has to supply you clean waste, not mixed together.
Sure. Thank you, sir. Thank you. Swati, over to you. And if you could be a little brief in the interest of time, because we would like to have another set of questions for the panelists and also some for Keith. Yes, over to you, Swati.
Yes, I'll be very brief, and I would really want to hear what Keith has to add. So yeah, we should all have time for him. I think very briefly, yes, adding on to what Dr. Brajesh said, that it's very important and pertinent to strengthen municipal waste management systems on ground. And by that, I mean that we should also use this time in investing in infrastructure in cities. I mean, of course, wet waste management is an area which could be taken care of, but dry waste management area, and where I also bring in recycling, is an area which would demand some sort of infrastructure creation, which would mean material recovery facilities, sorting centers, storage centers. So all those kind of modalities should be established in cities, because now we are also talking about EPR in the country. Very recently, just a few days back, the Ministry of Environment, Forest and Climate Change have published the draft document on EPR, and all those modalities will not work if the municipal systems on the ground are strengthened. So I feel municipalities have to work in setting up robust systems for dry waste management. For recycling, yes, in the entire period, and I think it has been mentioned in the earlier slides also, the sector has been badly hit, more so because recycling is a poor business in our countries. And if I talk about it, 60 to 70% of people involved in the sector are the informal sector. And most of them, due to the lockdowns, were pushed to leave cities and go back to their homes. So due to all these reasons and other reasons, they didn't have the financial bandwidth to, recover material or for that matter, even recycle it. So most of those businesses in past few months have been shut down, but I feel it all links from the ground. In a scenario where where systems that support segregation are created end to end, by which I mean segregation at source happens at household level. There is probably a primary and a secondary station where this material is taken, and then appropriate linkages with informal sector and recyclers are created. Apart from processing and other infrastructure that would be required for a city, these problems and challenges wouldn't exist. So I feel this is also an opportunity to reinvent waste management, to strengthen waste management in our cities. Coming to the question on what extra additions do we need in the guidelines, I feel we should rather change and strengthen the ground. I feel the only work that needs to happen is linkages between municipal waste collection and collection facilitated by the common biomedical treatment facility, and how are cities ensuring those linkages and transfer of such waste. Is it going to a primary center of a city and then going to the biomedical facility, or is it directly being collected from the household and straight away going from a quarantine zone to a facility? So all those modalities need to be worked out to ensure that there is no chance of infection to people or sanitation workers who directly deal with this waste. Thank you.
Thank you, Swati. Sameer sir, are you there?
Yeah, yes. Very much. Yeah. Solid waste management issues. I saw both the panelists, rightly pointing out that it is the municipality's responsibility, and obviously there's no point denying that. The point I was trying to raise is that is the typical NIMBY approach. The mentality has to, you have to come over that. If you're going to say that waste is not my responsibility, I will create as much waste as I want and throw it on the streets, and it is the job of municipality to collect it. That mindset needs to change. I mean, I had used the word called sanitation slavery. That's what I'm again going back to again. Your municipal employees are not your sanitary slaves to clean the garbage that you are putting, and that mindset has to be brought into the community as early as possible. You have to be reasonable, you have to be responsible citizen and take the responsibility also of the mess you create for your city. That's very important, because again and again I do find out the same issue that the municipality ka zimmedari hai, something that's the municipality's headache, not mine. That mindset needs to change. And secondly, the efforts that has been done, and that was one of the questions I was put. Let me tell you that post Swachh Bharat Abhiyan, there has been tremendous investment in the municipal waste management sector. In fact, what the scene was maybe before 2015 and what you see now, many smaller cities have been performing very well. In fact, the state of Maharashtra has been one of the front runners in all the efforts done in open defecation free cities, always also in the solid waste management part. So yes, efforts are being done. And I'm again looking for collaboration between the community and the municipality and the private sector to make a change that is visible at the ground level. I mean, during our work, we did travel to a lot of cities, and we were surprised to find it's just not in Maharashtra, but also in other states. Even the small and medium towns, in fact, are doing much better than the bigger cities, probably because the issue there is a bit manageable. Maybe in bigger metros like maybe Delhi or Mumbai or Hyderabad, Chennai, the volume is very high. But in smaller cities, small and medium towns, lots of work has been done. Thirdly was the guidelines. I'm sure guidelines coming from the Ministry of Environment and also the Ministry of Urban Affairs are extremely important. They they put things in context, give an indication what needs to be done. And the guidelines, of course, are evolving and making those getting them implemented at city level will always be a challenge for people from our sector. And as I keep on saying, to the reasonable and responsible citizens of the city. As far as biomedical waste is concerned, we already have in the last solid waste management rules, which were notified in, I think, in 2018. There is a provision of biohazard waste in in the rules itself. And in many cities, even many smaller cities, you would find that there is a provision for collecting a biohazard waste, number one. Number two, as far as the area which I have been earlier working, maybe the Mumbai metro region, the biomedical waste is that's a setup is been quite strong enough, and it does exist for last 10-15 years. So biomedical waste is not a new thing in solid waste management in Indian cities. And when I was earlier working there, there was all the garbage that was collected from the solid waste management on the containment zones or the houses of the suspected or quarantine area was collected separately. There was a protocol of spraying. The bags were distributed free by the municipalities. They were sprayed and they were shifted to the various biomedical management facilities which already exist in this part of country. I won't be in the position to speak what's happening in the other parts, but that was being done. So what I'm trying to suggest here that yes, the concerns that has been raised are being addressed. Many, right from the central government to the municipal government level, a lot of actions have been taken. The issue is creating an impact and spreading it to the every possible home. So that I think is a challenge, and that's the challenge where we require support and contribution from all the sectors of society, all the aspects of society. Yeah, thank you.
Thank you, sir. The next set of question is, I would like to start with those for it basically, these questions basically look for answers for the best practices or the way forward. So the question for Dr. Keith is, please share your experience of managing COVID and non-COVID waste in your own country, and how have you administered it? Can the cost-effective pouches be given to citizens to dump the masks, gloves, etc., and seal it while they give it to the waste collectors? Will this help in better segregation? And taking from there, a common question to the panelists is, what would it mean to give the waste workers a status of key workers or the frontline workers, and why is it important? And how would it translate to ensuring health and safety measures for the waste workers? Because waste management during these times would still require them to deal with the household and the biomedical waste. And another question was specifically raised on Facebook for Swati, as to your last slide, which showed the direct correlation, especially because it is suggesting a route for transmission from waste, which is not proven, since the coronavirus cannot survive beyond a few days living outside the cells. So, and the current cases, especially the surge in Bangalore, doesn't show this correlation. But also, it doesn't mean that one shouldn't follow the solid waste management and the local municipality rules on waste management, which are based on source segregation. So, your views on this, ma'am? And another question, which also perhaps if Dr. Keith could answer, considering the current report of the World Health Organization regarding the transmission of coronavirus through air, what are the points or the revisions that are needed, according to you, considering the solid waste management? Over to you, sir.
So thanks. Those were great questions. And let me start by apologizing. I mean, I've been watching a little bit of the question stream go by. You've captured some of them. There are many, many interesting questions that are not captured. And it's great to see the level of interest and from people, and apologies for those of you who we don't get to. I wanted to touch back on one point, which our third speaker made about the nature of waste management as an essential service. I think that's one good take-home message here. A lot of attention has been given to, say, healthcare workers and how they're an essential service, and how, we need to ensure that they have proper protective equipment and that they're properly remunerated for this essential service to society. I think it's much less common to hear that about the waste management. These are people who are have been working, while many of I've been at home, on lockdown, not going to work, but the essential services have to continue, and we should do everything we can to protect those people in providing us with those services, and waste management is a core one. Some other things that came out in the discussion: separation. It sounds like in India, you often have a situation where you're separating wet, dry. Separating out organics is really valuable for many, many reasons. I noticed one person asked about climate change. It's a lot of the climate emissions from the waste sector come from organic material, and separating out organics can be a way of reducing greenhouse gas emissions from the waste sector, or can lead you towards solutions to that. It also reduces the amount of the other waste we have to deal with. So our landfills are less filled, we can more easily recycle. So that's really one of the take homes, is how important that separation of organics is. Use existing systems. Someone asked about the pouches. Can we have some pouches and give people, it's possible, and it might work, say, in the next pandemic, but I do not think it's a good idea to try and right now institute a pouch system in a city in India, because nobody will know what they are. There'll be so much learning that has to go on. What do I put in the pouches? Where do I put the pouches? That it won't really be an solution to the urgent needs we have now. So I would like to try and separate out, great ideas that we can think about in the future, because there'll be more pandemics and more issues like this, and how to deal with the challenges today. And for the challenges today, it boils down to using our existing systems. So there was a question about other countries. Every country,
Dr. Keith, are you there with us?
I think we lost Keith. Should I come in, Simi?
Yes, you can come until
we could resume. Could you repeat the question again, Simi, very quickly?
Yeah. The question was basically, to just put it in a nutshell, that the last slide that you have shown, it shows a direct correlation, but the question, according to Ms. Shyamla Manish, says that it is actually difficult because the route of transmission from waste, which is not proven, since the coronavirus cannot survive beyond a few days outside the living cells. So does that mean that one shouldn't follow the waste management rules properly, which are based on source segregation? She is actually questioning that it is absolutely vital, but such simplistic solution or correlation can be questioned. So your thoughts on this based on your last slide?
I think what I wanted to share via the last slide was actually that cities that in very holistic manner are adopting, the rules, which if you really go by the rule book, by a solid waste management rules 2016, then it ideally means you segregate, you treat at source or at a centralized or a decentralized facility, and you recycle, and you ensure that there is minimal disposal of waste. And cities that are doing that, we're also observing, who are like following this pattern holistically, we're also observing that there we have less number of cases, of course, leaving behind Bangalore, where this was June's data, which I had analyzed. But of course, if we look at present data, Bangalore has a surge. But of course, we can't negate the fact that there is a need to adopt more localized action, which would mean segregation at source and treatment at source, mobilizing communities, networks, volunteers, NGOs, or even RWAs, resident welfare associations for bigger cities for that matter. So I think, just to clarify that, I didn't mean that we don't have to follow the rules, and we definitely have to follow the rules. And if we go by the rule book, then I would also feel that this entire discussion around the safety of workers, waste in itself is an essential service. So of course, if we are better at it and more effective at it, I'm assuming that we're also reducing the chance of infection to workers and municipalities who are at the front end of it. Yeah. Thank you. And I think just to add also, there was one other question which I felt was very relevant, directly asked, which was, should we look at, changing policies and then looking into implementation? I feel sometimes better practices also influence policy. And previously, I've been a part of projects and engagements where some effective practices on the ground changed state level legislations and city level legislations and ensured other cities replicate similar practices. So also documenting good practices and bringing them at the forefront, both at central and state level, to policymakers is also imperative to have better, to reflect better changes in the policy as well. So I feel we should all the time, as researchers, as people who are very actively working on waste, should always be on a lookout of what's happening around. Is there a good practice nearby to document and share it on a bigger platform? Because that always brings it on the center stage and helps in replicating the practices, as well as also making a bigger change at policy level. So I feel practice to policy in today's times is also quite imperative. Yeah, thank you.
Thank you, Swati. Dr. Keith, could you come in? We are sorry we lost you for a bit. You were talking about the climate impact, climate change.
Yeah, I apologize. My internet seems to have dropped out briefly. I was talking about separating organics having multiple wins, both on climate and on waste management. I mentioned we should be using existing strategies, and many countries have different ones. So it's not necessarily a question of learning best practices from other cities or other countries, because if you have different existing structures and existing collection schemes, and you'll have to have different responses to the COVID. I wanted to just answer one other question that I think came up, which was, well, now we hear that COVID is transmitted by air, so all the waste management doesn't matter anymore. Well, maybe. It does seem to be that, well, many scientists have suggested that the WHO acknowledge this, and WHO is probably going to do that soon. I would say all that does is show us the importance of adaptability, of learning as we go. There will be all kinds of new developments that are going to occur in this pandemic. So any solution that we think of now may or may not be a solution then again in another few weeks or a month, depending on the locality, depending on how overrun the hospitals are, how overtaxed your medical incinerator is, etc. So that's just a plea for continual learning, continual adaptation, and with a focus that, always on reducing transmission through the waste streams. That's what we're talking about here, but also making sure you're looking at the big terms. If it's true that most of the transmission is by air and not through surfaces, I'm not saying that's true, we don't know, but if it is true, we have to rethink a lot of what we're doing right now, because that would be a new piece in this in the puzzle. So I do think we need to be adaptable. Let me stop there, and I'm sorry about the technical hiccup.
No problem, sir. Thank you very much. Professor Dubey. So please unmute your mic.
So yeah, what was the question you had for me? After you are muted now.
Yeah. So one question was definitely on the climate impact. If you could also throw some light on that. That was one question. And one very interesting question that is coming up on the Facebook Live is that could you tell us whether sterilization really works for treating the PPE? And are the UV sterilization devices effective? And those that are being set up in the industries and organizations to treat the masks? Or could you even suggest a few local sterilization techniques before disposing it to the municipal waste? So basically, to know what at the individual level the people can do amid the crisis. And also the question on the emissions, the climate emissions, which are being posed by the COVID waste. We are in a climate emergency after all, particularly the particulate matter, heavy metal emissions, and all such emissions that are there. And considering the environmental impacts that lead to different conclusions, what are your thoughts on that?
Okay, so regarding the climate impact, I think Keith explained it very detailed. So if you have the organic waste separate, definitely you say if whatever you do, if you do anaerobic digestion, if you don't collect the methane gas properly, and anaerobic digestion gas, of course, you should be able to collect methane properly. But then when you convert it to CO2 because of the gas prices, natural gas prices being low, then you lose all the benefit. Similarly, for me, landfills, if you have the organic waste in the landfill, methane emissions is a big problem. The fugitive emissions from even good sanitary landfill has a collection efficiency of around 55–60%. So of gas. So we lose around 35 to 40% gas to atmosphere anyway. So those are the issues in terms of, so of course, that impact the climate change. If we have the organic collected separately, that helps in reducing that. In terms of sterilization and using like reusable PPEs, there are, again, I would qualify by saying that I'm not a medical expert, so don't take my advice from a waste management point of view to reduce the waste. Yes, based on the information that is out there, I think using, like, if you have a good N95 mask, which you can put if you can, you can reuse that. You have to, of course, you have to sterilize that in terms of, and even if you can use cloth mask, like if you have a 3-layer cloth mask in India right now, if you have a 3-layer cloth mask, that is quite popular. People are using those cloth masks, 3-layer cloth masks. And using mask, again, as Keith was also mentioning, it's a very dynamic exercise right now. Today we have some advisory, tomorrow we have some other advisory, and day after tomorrow we'll have some other advisory. And mask is useful. If it's not airborne, then mask was needed only when we go to the crowded places. If I'm sitting in my house, or if I'm just walking just outside my house, possibly I don't need a mask if it's not airborne. But if it's airborne now, of course we need to use the mask. So 3-layer cloth mask, again, I'm not a doctor, so I would like to make it very clear. And then that can be reusable, and that can be washed and reused. And if you use PPEs and other stuff, which you have to throw in the garbage, we talked about it earlier, that put it in 2-layer plastic bag, once in there and the other. If you want to wash it down if you wash it down hot water for again, that was based on some initial studies which came out that if you have higher temperature will kill it, but we are seeing that possibly that is also not working. We are in middle of summer in India, but virus is still around here. And in terms of hygiene, the basic concept of hand washing is still true. It still holds. The 20 seconds of hand washing, that advisory is still there. And that advisory is from that wash campaign, that water and sanitation campaign that is going on for a few decades now. So that still holds good. So 20-second hand wash is, I think that will not create many PPEs, especially if you have the gloves and other stuff. Then you talked about emissions in terms of waste management. From the organic, we talked about that. Transportation, again, if you go there are a lot of emissions in transportation as well when we collection and transportation of garbage. So there is always a debate between decentralization and centralization of waste collection. Decentralization will help reduce some of those emissions in terms of the transport, but again, you need to have the economy of scale. The plant has to be, for example, if you set up a waste to energy plant, it needs to get around 300 tons per day. If it doesn't get 300 to 350 tons per day, it may not be economical viable. So you need to bring the garbage from different places to make it economical viable. Air pollution, as per rule or as per the technology which is out there, we have the technology out. Our rules are strict enough to take care of the air pollution problem. The problem comes when we don't implement the rules properly, when we try to do some shortcuts in air pollution control system. When we visit some of these plants, the air pollution control systems are actually shut down, and it works only when CPCB or SPCB is making a visit. So that's the pollution control board making a visit. So so this is a more of operational challenge, but most of the emissions coming out from waste management treatment plants can be controlled, including dioxin, furans, and other stuff. You go to Western European countries, they have wonderful waste to energy plants. If you go to Vienna, their waste to energy plant is so nice, and even in Amsterdam. and they are able to control air pollution systems. It's costly than landfill, but it can be doable.
Sure, thank you. Sameer sir, would you like to add in some points before we hand over to Dr. Keith for his concluding remarks?
I think all the panelists have, made very pertinent observations. Very, in fact, I come from the operations side. I'm a practitioner, so I sometimes find issues to put my actions into a proper conceptual framework. And this actually, I benefited more in this interaction rather instead of being panelist. I think I was more of a participant here. Yeah. So I think 3 issues I would just like to flag on. Number one, COVID has expressed, our features in the way we were looking at urbanization. So it has to be a learning experience for us on to how to move ahead with the larger issues of urbanization, not only in India, but probably all over the world. Secondly, the triad of challenges that we have in coming decade, and we are into the 3rd decade now, would be of climate change, would be of the attaining the SDGs, and of course bringing the economy back after the COVID comes up. Cities have been the drivers and most important players on all these 3 aspects, and therefore there will be a bigger learning for all the cities. And the point raised by Swati, which was on there, has to be greater collaboration, identifying best practices, circulating them, and creating a framework of they getting executed and implemented in the various cities. I think would be a challenge that we'll have to face in coming. Thank you.
Thank you, sir. Dr. Keith, over to you.
So I think we're summing up now, right?
Yes.
So
yes.
I think it was a great discussion. We had some really different perspectives from practitioners in municipalities, from more theoretical, university type research, and looked at a lot of different cities around India, big ones, little ones, decentralized, centralized. There were 2 main themes that we touched on. One was, what are some urgent actions? What can we do right now to reduce our vulnerability to this disease, to improve, to make sure we use our existing systems well, and that we recognize the essential service of waste management. That's all the things, what do we do with our masks, all that kind of stuff. That's really important. But another one, and a lot of the questions touch more on that, the ones related to climate and other, is how do we use this transition, this sudden shock to our systems to build tomorrow better? What are some overall thinking we can make and take this transition that's bound to happen, because so our lives and our societies have been so dramatically shocked, that we can build out to tomorrow in a better way. And some of that is about waste management, about now the concepts that I think a lot of us know is about reduce our waste. We can do that through design. We can do that through behavior. We can do it lots of ways, but reducing is really the first pillar of what we want to build in tomorrow better, is a system where we have less of it. Reusing, we talked about, can you reuse masks? And the answer, I think, was pretty much yes, you can. I have one and I reuse it. I know doctors in the United States are now reusing their masks. So, yes, you can reuse, and reusing is a good thing. Do it wisely. Think about, how we can maximize reuse after reduction. And then there's recycling, and recycling is impacted by everything we've been talking about, by separation, and only at the very end of all that, after we've done our reducing, our reusing and recycling, are we talking about end of pipe solutions, like, we talked a little bit about municipal solid waste incineration, about sanitary landfills, etc. But that should be an end of pipe. That should be a small little bit that we're talking about at the end. So hopefully we can at least to some extent as a society think about, beyond the urgent measures, how we're going to build tomorrow better, how we're going to take lessons to transition to a less wasteful society, and one that better reuses our precious resources and maintains our wealth. our natural capital in the environment, our social capital in our educated populations, and our real wealth, rather than just always trying to grow our economic gains through GDP increase, for example. So thank you very much, everyone, for that very wonderful discussion. And sorry again to the many, I see a very interesting discussion going on the side about whether there are dioxin emissions in Europe. I think those are great questions, but we have to come to an end. So thank you, everyone, for your participation.
Thank you so much, Dr. Keith. I would now request Dr. Arjun Kumar, Director of Impact and Policy Research Institute, and Ms. Ritika, Senior Research Assistant, to formally give the vote of thanks before we log off. Over to you.
Thank you. Thank you, Dr. Simi Mehta. And thank you, everyone, for this wonderful panel. I really learned a lot and enjoyed every bit of it, especially from our chair. It's like, the leadership in knowledge is leading us, and our very wonderful panel from practitioners, administration, advocacy, academics and research point of view. It has been very stimulating. And I would just like to add a few lines that this pandemic has again brought a renewed focus on waste. And not so because of the economic aspect or the growth of waste, but because it poses a security threat to us, to humans. And now how we are living sustainably, interacting with environment and with Mother Earth is being questioned again. And the very notion, especially in developing countries like India, is of the behavior change. And now that can be grasped, focused upon, and a renewed focus can be given. What can we see in terms of sustainable production and consumption of all the resources, circular economy, the zero waste in terms of soil, solid, liquid, and gas. And I thank all our champions working in this field of resource management and putting forth all this discussion and nuances for a wider dissemination. And once again, I would also like to reiterate that now we should focus and make waste as a non-negotiable priority and agenda post this coronavirus pandemic. And this is also an opportunity for all of us, those who have given our decades of research and work towards working on this goal. The government of India, the Swachh Bharat Mission, Clean India campaign has made marvelous success in terms of making India open defecation free, in terms of constructing toilets, and we have achieved almost universal targets there. Now the next phase of waste management is the key, and I think with the participation, the feasibility, technology aspect in a more decentralized way, we can do promote entrepreneurship and also have common wisdom towards this very sensitive issue. I really like to thank Dr. Keith Alverson to guiding us thoroughly and promoting us to hold this event on this very important topic. And from Japan, thank you so much, sir. I would also like to thank Swati Singh Sambyal ma'am for agreeing to come here and share such a wonderful presentation. Everyone is in the chat group is asking for the presentation. We will share this with the due permission and also upload it in our website in the event page. And Mr. Sameer Unhale, sir, thank you for coming and finding time, especially when all dealing with containment zones there. And thank you so much for sharing the administrative perspective, that how hard it is and how municipality are handling these issues, especially when all the municipal staffs are also affected very badly with this virus. And finally, from the panelists, I would like to thank the champion and our garbologist, Professor Brajesh Kumar Dubey. I'm a very keen and interested in his work and a very fan kind of student of his on this topic. And he guides us so well for this topic in India, and working on so many projects on, a Clean India mission and a Clean Ganga mission, all the projects in Assam, going into every landfill and looking into these aspects. Thank you, Professor Brajesh Kumar Dubey, sir. And I would also like to thank the organizer, Dr. Simi Mehta, Anshula, Ritika, Professor Balwant Singh Mehta, for making this happen. Ritika, you can please add, yes.
Unmute, Ritika. Ritika, unmute your mic.
Yeah. Thank you so much, sir. On behalf of Center for Environment, Climate Change and Sustainable Development, Impact and Policy Research Institute, I would like to thank Dr. Keith Alverson for chairing this session and draw attention towards this pertinent issue in his opening remarks. He also highlighted 3 R's for a better tomorrow. Thank you, sir, for your invaluable time. I would like to thank Ms. Swati Sambyal for accepting our invitation. She highlighted the challenges being faced by workers treating the increased biomedical waste. She showed that decentralization of urban services, segregation, and citizen engagement are some of the practices lessons. I am also thankful to Professor Brajesh Dubey, who highlighted the problems faced by recycling industries and challenges posed by increased use of single-use plastic during lockdown. He stated that practices such as chemical recycling, automated incineration can help us reducing waste. Thank you, sir, for joining this session. I am also thankful to Mr. Sameer Unhale for joining the session. As rightly said by him, there is need to recognize the work of manual scavengers because they are not sanitation slaves. He urges for individual participation of citizens and community engagement with involvement from private sector. Thank you, sir, for devising ground level actions which can be really helpful in tackling this issue. I would like to thank Dr. Simi Mehta for being a moderator and managing the session effectively. Thank you, ma'am. Lastly, I would like to thank Dr. Arjun Kumar and Ms. Anshula Mehta for organizing this discussion. I extend my heartiest regards to all the attendees on Zoom and on Facebook Live. I am hoping that this session would have definitely opened new thoughts in young minds of our young scholars working in the field of waste management during pandemic. Thank you so much for attending this session.
Have a nice day.
Have a nice day.
Before
Yes.
we log off, can we just a bit, if all the panelists, Sameer sir, if you could turn on your video so that I can take group photographs. 1, 2, 3. 1, 2, 3. Yeah. Thank you and have a very good day. Thank you, sir.
Thank you. Goodbye.
Thank you, Dr. Keith.
Hi,
Thank you,
everyone.
Swati.
Lovely
Thank you.
discussion. Thank you. Bye, Keith. Bye, Simi.